Well, we need to talk about connective tissue diseases as a group. And, of course, none of these are genetically transmitted, although the medical doctors say they are. And some of them, they would say, are autoimmune, and none of them are autoimmune. They're just simple nutritional deficiencies, are sometimes set up by malabsorption problems. And they're quite common. It's kind of absurd when you look back 50 years ago, medical doctors saying, well, osteoporosis is a disease of middle-aged or elderly women over the age of 50. When they start going through menopause, they don't have enough estrogen to make sure that they can absorb and utilize calcium. That's all nonsense because men equally get osteoporosis, and they don't have a lot of estrogen. And so many of the things that medical doctors say are absurd on the face of it. Now remember, going back to the pharaohs, thousands of years ago, 5, 6, 7, 8,000 years ago, there's been thousands of failed medical theories every century, and the 20th century and 21st century is no different. So let's look at some of these. Fibromyalgia, sarcoidosis, lupus, these are all kind of cousin diseases, thought to be autoimmune, body attacking itself. No. In almost every case, people will have a gluten intolerance, and about 80% of Americans have a gluten intolerance. Wheat, barley, rye, and oats, got to get rid of it out of your diet. All sources, all forms. Cross-contamination in the household. Spouse, mother-in-law, renter, dog, cat, bird, fish, food, all that stuff's got to be gluten-free for you to be gluten-free. And then, of course, you get these connective tissue diseases, again, sarcoidosis, lupus, and fibromyalgia, because these people are not absorbing nutrients if they're there. If they're not there and you're not absorbing, they're really going to have a rough case here. And so here's a case where getting gluten-free and getting them on appropriate for body weight, what we would call the 90 essential nutrients, the healthy bone and joint pack, and they're designed to support and promote maintenance repair of cartilage, ligaments, tendons, connective tissue, disc between the vertebrae, bone rates, bone itself. And then, of course, you get back problems, bulging disc, ruptured disc, things like peripheral neuropathies, like sciatica and irritable bladder syndrome, things like atrial fibrillation. And, of course, the 12 pairs of cranial nerves that come out from the brain through the skull, if any one of them are being squeezed because a person has osteoporosis of the skull and the face, you're going to get Bell's palsy, trigeminal neuralgia, gradual deafness, Meniere's disease, a.k.a. Wallach's vertigo, and so on. You can begin to lose your voice, aphonia, okay, because the lingual laryngeal nerve, number 9, is being squeezed. The root set is being squeezed, and then people lose their voice. I've helped people get their voice returned, and of course the husbands are angry. They say, I was having a pretty good time here for 5 years when she couldn't talk. Now you fixed her and she can talk again. And it's kind of funny. I think they're making a joke. I hope they're making a joke. Okay, then there's osteopenia, osteoporosis, osteoarthritis, degenerative arthritis, bone-to-bone arthritis, rheumatoid arthritis, and these are due to simple mineral deficiencies, vitamin deficiencies, vitamin D, vitamin A, vitamin C. All of these are direct contributions to the formation of and maintenance repair of bone, cartilage, ligaments, tendons, connective tissue. And, of course, you have the 60 minerals, all of which are involved in bones directly. Of course, the preponderance of the bone is made up of calcium and phosphorus and magnesium and manganese and so forth. And so this is a fairly complex thing. On one hand, conceptually, it's simple. If you lose 85% or 90% of your absorbed surface because you have really severe gluten intolerance and you don't have much in the way of these minerals in your diet, then you're going to have some really severe connective tissue problems early on as a kid. Then if you're deficient, because there's none of the soil where you're living and you're growing food or you're eating food grown from local farmers, as everybody suggests, guess what? You're going to be minerally deficient. You're going to wind up with these problems. Now, rheumatoid arthritis, in addition to being bone-to-bone arthritis, has another component to it. It's an infection with a bug called mycoplasma. And mycoplasma is killable in 2 weeks with an antibiotic called minocycline, a member of the tetracycline family. And I like to throw in the killer biotic. Killer biotic is a blend of 8 herbs, 2 of which also have antimicrobial properties and can kill bacteria, fungus, and yeast and viruses. They do primarily support the immune system, which will help your body fight off the mycoplasma, the bug that's involved in things like rheumatoid arthritis. Now, periodontal disease is one I really, really have a hard time with doctors and dentists. periodontal disease is osteoporosis of the skull and the face and the jaw. They either forget to tell you, don't know themselves, so they can't tell you, that when you get osteoporosis of your legs, your pelvis, your vertebrae, and your ribs, you're also getting osteoporosis of your face and your skull. This is why little old people look like little old people. You look at their pictures when they were 25 or 30 years old, they had a nice fleshed-out face, and they look like a 35-year-old person. They get to be 65, 75. Now they look like a 75 to 100-year-old person. There's a lot of wrinkles on their face because the bone is beginning to go away underneath the skin. And they look like they've lost 50% of their bone mass in their face. That's why they look like little old people. I call it the little old people look. Okay, this is just simple osteoporosis of the skull. Your bone begins to go away. Your teeth get loose, and dentists want to put in implants and give you dentures. Think about the Healthy Bone and Joint Pack, Epigenetics, the book, Somebody Needs to Go to Jail, the DVD, and Public Enemy #1, the CD.